Hey guys, what's going on? This is John from Friends with Your Benefits. Look, getting old definitely stinks. I'm almost 40 and I'm starting to see some wrinkles on my face. And I started looking at some options out there in the marketplace to perhaps de-age myself, right? And start looking more youthful and having my skin look good. Hopefully it looks okay today. So joining us today for part 2 of our interview, we have Dr. Gary Nackman from NJVeincare. Hey, Dr. Gary, welcome back to the show.
Thanks, John. Good to be back.
So, Dr. Gary, I think, we were kind of touching upon it earlier. I think within your practice, you have some cosmetic procedures that you could do to perhaps find the proverbial fountain of youth. So let's talk about that, if that's okay.
The name of my practice frequently is called NJVeincare.
Sure.
But we also refer to ourselves as NJVeincare and Aesthetic Center. Over the years, we've developed certain expertise in the use of laser and some other modalities to improve your skin. Basically, as we get older, our skin gets exposed to things that it just doesn't like, primarily sun. You know, people like to have what looks like a healthy suntan, but the UV rays of the sun just really are brutal. And with age, we develop, little wrinkles, the little crow's feet kind of at the corner of our eyes, the 11s,
Yep.
kind of between our eyebrows, wrinkles on the forehead. We can develop age spots, sun damage, lots of problems. And those can easily be addressed with very routine procedures. Probably the most efficient procedure that we do is something called a fractional non-ablative laser. I use the SculpSure Icon 1540 fractional non-ablative laser system to get rid of those fine lines and wrinkles. It can also be used to treat hyperpigmentation, something called melasma. And it's a series of treatments that are performed to heat up the collagen in the skin and causing a little bit of minor damage. And this minor damage then commands the body to repair itself in a more youthful appearance, getting rid of the fine lines and wrinkles.
So when I hear the term laser, and I'm going to go there, I think of Star Wars, right? So what are these lasers like? What do they actually look like?
There are so many different types of lasers. You think
Okay.
of it as a box.
Okay.
This box creates light with a single wavelength of light. And that light is then delivered through a handpiece onto your skin. And depending on what the wavelength of the light is and the amount of power and how quickly you deliver it in a pulse, it can accomplish different things. We use something called an ND-YAG laser to treat facial veins. Some people have the little blue veins under their eyes that develop over time, or on their temples, or little red thread veins on their nose.
Yep.
And we can very successfully use an ND-YAG laser to treat those veins, and they typically disappear in just 1 or 2 sessions. Some people have what's known as a venous lake on their lower lip, most commonly. It's a blue venous malformation. And historically, people had surgery to have those removed, which is very disfiguring. And with typically 1 to maybe 3 treatments, those can be 100% eliminated. For age spots on the face, we use something called an IPL, intense pulse light, which is kind of a cousin to a laser. It's a group of different wavelengths of light that can be used to get rid of age spots. It can be used to get rid of rosacea, the pink tone on people's cheeks. We can use another laser called an Alexandrite laser to remove age spots as well on the back of the hands, on the face, even on the legs.
So very neat right there. So what about acne, right? So let's say someone happens to have an acne scar, what have you, or perhaps let's say they're getting married and they break out and they get that giant zit. Is there anything that you can do for that?
Certainly. The use of IPL actually can help acute acne as well as the 1540 laser. It kind of brings it to a surface. In terms of acne scarring, we do 2 different procedures. One is light-based. The other is a microneedling procedure. The 1540 is great for acne scars. The very deepest of scars, though, I would refer out to have some kind of filler injection sometimes.
Interesting.
The ProCell microneedling system is what we perform in the office as well.
Right.
It you can think of it almost as a tattoo gun, but it's a pad that has multiple needles of, depending on the part of the body and what we're treating, they have different lengths. And after numbing the skin with a topical agent and cleaning the skin, it vibrates and creates little microchannels. And then we can use stem cell derived growth factors to help the body to heal in a more natural factor. They're both FDA approved, the 1540 and the ProCell microchanneling. And frequently we create a program of where we would alternate the treatments, spacing in between.
So since you mentioned tattoos, you're not doing tattoos in your shop, right?
No, we don't. I don't do tattoo removal either. Yeah.
Okay, fair enough. So one thing I just want to touch upon, right? So what is the recovery like? So let's say someone gets this. Do the lasers hurt? Is it like, do they have to put moisturizer on after? What do you typically recommend?
There's really minimal discomfort associated with the treatment. Frequently, we do use a topical anesthetic cream that we put on the skin for approximately 20 to 30 minutes. And then the laser procedures are performed, or the microchanneling. There's a little bit of what we call downtime after the procedure, where your skin is red like you fell asleep on the beach.
Yeah.
But that really disappears within a day.
Really?
And just very light redness, maybe 2 or 3 days on these procedures. There are other laser systems out there that have much greater downtime. An ablative laser, like a CO2 ablative laser, which is very strong, but and they have their role as well. But my patients really prefer the shorter downtime.
Okay.
So that's why I use these.
Fair enough. And obviously, I think since it's cosmetic, that health insurance generally would not cover these procedures, right?
That is correct. Yep.
But one thing I think that is interesting that we're starting to see in the marketplace on the employee benefits side is there's actually these things called lifestyle spending accounts, and they're post-tax benefits, and they could be used for a variety of things, such as gym membership. Maybe, if you want to do tanning, obviously I know you're not pro tanning here, at least naturally, right? But they can be used for cosmetic procedures. So it would be interesting to see if you happen to see a card in the future for a patient coming in saying, hey, my employer is offering me, Gary, a lifestyle spending account. Can you actually charge the debit card here, and whatever the balance is, I'll pay you directly?
I think that's a great idea. We haven't really seen patients with that yet. We do see patients using Care Credit, which is a financing company, to finance both medical and cosmetic procedures.
Fair enough. So we spent a little bit of time talking about lasers, right? So now that we are in 2023, we talked a little early in our previous video about New Year's resolutions. So a lot of people are trying to find a healthier version of themselves, right? And they may have some stubborn belly fat. Is that something you can help with?
There is a procedure called SculpSure, otherwise known as warm sculpting, that can help remove stubborn fat from different places in your body, particularly when diet and exercise hasn't been enough. It's not a weight loss program.
Okay.
It's really for people who have just a little bit of extra fat that they'd like to be removed. It can be used under the chin. It can be used on the abdomen. It can be used on your flanks, on the thighs, the bottom of the arm sometimes is used in an off-label way, but it's very successful at that as well.
So let's say I want to get that six-pack of abs. Is that something you can give me, Gary?
I think you go to the gym first and focus on good nutrition.
Okay.
But it's certainly an extra tool that's commonly used all over the country. Yep.
Very cool. Is there anything else that you do in your practice that you want our audience to know about?
Well, our main focus is both medical and cosmetic venous disease. And for the spider veins of the leg, we do injections. We do foam sclerotherapy with a drug called Sclera, which is a mild detergent put in a syringe, injected into the little tiny thread veins on your leg, and it pushes the blood out and basically closes the vein. We also do laser of leg veins for those veins that are too small to put a needle in and inject. And they're very well tolerated. They work great. It's not a magic wand. It takes a little bit of work. It takes a little bit of time for healing to occur. But really, the overwhelming majority of patients are very happy with those procedures.
Now, as it relates to health insurance, right, how does an insurance company actually determine if, let's say, there's a vein and you're trying to remove it, or maybe it's cosmetic? What's the determining factor there?
It really depends on the anatomy and the findings on the ultrasound. Insurance is willing to allow the removal of big bulging varicose veins if certain criteria are met. If the saphenous vein, where the valves are bad, has already been closed or surgically removed, they will then allow the removal of the veins, or if a vein is ruptured and there's been bleeding, they would allow an injection or removal of those veins as well, or if there are multiple episodes of inflammation of the vein, what we call phlebitis.
Very cool.
Yeah.
So, Dr. Gary, thank you so much for coming on the show today. And for the audience out there, let's say they want to get in contact with you and perhaps take a look at some of these cosmetic procedures. What's the best way that they could do to actually get in contact with you or find more information about your practice?
Sure. For more information, go to our website at NJVeincare.com, or they can call my office, 973-778-2222, or send me an email at info@njveincare.com.
Well, thank you, Gary. Really appreciate you coming on the show today. And for those of you out there, we want to hear from you guys. We encourage you, as always, to subscribe, comment below, and if you're on LinkedIn, feel free to follow me. I'm John Coleman. Thank you for joining.